Erythromycin Ethylsuccinate is a medication that is used to treat a wide range of bacterial infections and may also be used to prevent certain bacterial infections. It is known as a macrolide antibiotic and works by stopping the growth of bacteria in the body. It's important to note that this medication only treats or prevents bacterial infections, and will not work for viral infections such as the common cold or flu. Using this antibiotic when it is not needed can cause it to not work for future infections. It is typically taken by mouth with or without food. The dosage and length of treatment are based on your medical condition and response to therapy. Be sure to take this medication at the same times each day. If you have any questions about the best times to take this medication, consult your doctor or pharmacist. When taking erythromycin ethylsuccinate, it's important to follow your doctor's instructions. You can take this medication with or without food, but if you experience nausea, taking it with food or milk may help reduce this side effect. Erythromycin ethylsuccinate has a bitter taste if crushed, so it's best to swallow the medication whole and not chew or crush it. The dosage and length of treatment will depend on your medical condition and how you respond to the treatment. For children, the dosage is based on their age and weight. To get the best results, take this antibiotic at the same times every day. This will help you remember to take it and keep the medication at a consistent level in your body. If you're using this medication to treat an infection, be sure to take the full prescribed amount, even if you start feeling better before it's finished. Stopping the medication too early could cause the infection to come back. If your condition doesn't improve or gets worse, be sure to contact your doctor. If you're taking this medication to prevent certain bacterial infections, it's important to take it exactly as directed by your doctor. Don't stop taking the medication without your doctor's approval. Some common side effects of erythromycin ethylsuccinate include nausea, vomiting, diarrhea, stomach pain/cramping, and loss of appetite. However, taking this medication with food may help to lessen these symptoms. It has been prescribed to you because your doctor believes that the benefits outweigh the risk of side effects. However, it's important to tell your doctor if you experience signs of liver disease, unusual tiredness, muscle weakness, trouble speaking, blurred vision, drooping eyelids, hearing loss, severe dizziness, fainting, fast/irregular heartbeat, or severe intestinal symptoms such as ongoing diarrhea or abdominal pain. Additionally, using this medication for prolonged periods may result in oral thrush or a new yeast infection. If you notice any new symptoms, contact your doctor. While a serious allergic reaction to this drug is rare, seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects, be sure to contact your doctor. Before taking erythromycin, it's important to let your doctor know if you're allergic to it or other macrolide antibiotics, as this product may contain ingredients that could cause allergic reactions. Also, make sure to inform your doctor about your medical history, especially if you have kidney disease, liver disease, or myasthenia gravis. Erythromycin has the potential to affect the heart rhythm, which can lead to serious symptoms that require immediate medical attention. This risk may be increased if you have certain medical conditions or are taking other drugs that may cause QT prolongation. It's important to discuss all the medications you're taking and any existing heart conditions with your doctor before using erythromycin. Low levels of potassium or magnesium in the blood may also increase the risk of QT prolongation, especially if you're using certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. Be sure to talk to your doctor about using erythromycin safely if you have these risk factors. Erythromycin can also interfere with the effectiveness of live bacterial vaccines, so it's important to inform your healthcare professional if you're using erythromycin before getting any immunizations or vaccinations. Additionally, make sure to inform your doctor or dentist about all the products you use before having surgery. Some erythromycin products may contain sodium, so if you're on a salt-restricted diet or have a condition that could be worsened by an increase in salt intake, it's important to discuss this with your doctor or pharmacist. Older adults may be more sensitive to the side effects of this drug, especially hearing loss and QT prolongation. It's important to inform your doctor if you're pregnant before using this medication, as it can also pass into breast milk. Be sure to consult your doctor before breastfeeding if you're using erythromycin. When taking erythromycin ethylsuccinate, it's important to be aware of potential drug interactions. This medication may interact with other drugs such as digoxin, affecting how they work in your body. Additionally, erythromycin can slow down the removal of other drugs from your body, which may also impact their effectiveness. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to avoid any potential complications. Certain medications, such as azole antifungals, calcium channel blockers, and anti-seizure medications, can affect the removal of erythromycin from your body, while other drugs like bromocriptine and certain benzodiazepines may be affected by erythromycin. It's essential to inform your healthcare providers about your erythromycin use as it may interfere with certain lab tests, potentially causing false results. Remember to follow your doctor's instructions and do not start, stop, or change the dosage of any medicines without their approval. If someone has taken too much erythromycin ethylsuccinate and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to remember not to share this medication with others. This medication has been prescribed specifically for your current condition, so it's not recommended to use it later for another infection unless your doctor advises you to do so. If you forget to take a dose of erythromycin ethylsuccinate, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take your next one at the usual time. Don't take a double dose to make up for the missed one. Remember to store erythromycin ethylsuccinate at room temperature, away from light and moisture, and be sure to keep it out of reach of children and pets. It's important not to flush this medication down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.